How do Quantiferon-TB Gold Plus and T-Spot.TB methodologies differ? Imagine two different ways to check if someone has been exposed to tuberculosis. Both are blood tests called interferon gamma releases assays, or IGRAs, but they work quite differently. Let's explore how these two tests, Quantiferon-TB Gold Plus and T-Spot.TB, actually differ in their approach and what that means for diagnosis. Quantiferon-TB Gold Plus measures the total amount of interferon gamma released into the blood plasma after the blood is mixed with specific TB antigens. It uses whole blood, which means you draw blood and put it directly into special tubes containing these antigens. The blood is then incubated, and an enzyme-linked immunosorbent assay, or ELISA, measures how much interferon gamma is present. The more interferon gamma released, the more likely it is that the person has been exposed to tuberculosis. This test has two tubes, called TB1 and TB2. TB1 mainly stimulates helper T cells, known as CD for cells, while TB2 stimulates both helper and cytotoxic T cells, called CD8 cells. This dual stimulation aims to improve sensitivity, especially for recent or active infections. T-Spot.TB takes a different route. Instead of testing the whole blood directly, it first isolates specific immune cells called peripheral blood mononuclear cells from the blood sample. These cells are then exposed to TB-specific antigens, mainly ESAT6 and CFP10. The test uses an enzyme-linked immunospot, or ELISpot, technique to count the number of T cells that produce interferon gamma. Instead of measuring the total amount of interferon gamma, T-Spot.TB counts how many individual T cells are actively secreting this immune signal. The results are given as the number of spots, with a certain threshold indicating a positive or negative result. When it comes to interpreting the results, Quantiferon-TB Gold Plus provides a numerical value of interferon gamma concentration. If the level exceeds a certain cutoff, the test is positive. If it's below, it's negative. Sometimes results can be indeterminate, especially in people with weakened immune systems. T-Spot.TB, on the other hand, counts the number of spots, and if the count exceeds a set threshold, the test is positive. If it doesn't, it's negative. Both tests are quite accurate and are used to diagnose latent or active tuberculosis infections. In terms of laboratory processing, Quantiferon-TB Gold Plus is simpler because it only requires drawing blood into special tubes and then running an ELISA. T-Spot.TB needs an extra step to separate the immune cells before testing, which can take more time and requiring more specialized lab equipment. Both tests usually have similar turnaround times, but their differences in processing can influence their use in different healthcare settings. Clinically, both tests are reliable, but they have some differences. Quantiferon-TB Gold Plus might produce more indeterminate results in people with weakened immune systems. T-Spot.TB can sometimes be more consistent because it counts individual cells, which may reduce variability. However, the choice between them often depends on the laboratory capabilities and the specific patient situation. In summary, Quantiferon-TB Gold Plus measures the total interferon gamma released in whole blood after stimulating both helper and cytotoxic T cells with two antigen tubes. T-Spot.TB counts the number of T cells actively producing interferon gamma after isolating immune cells from blood. Both are valuable tools for tuberculosis diagnosis, each with its own strengths and processing methods. Always remember, for any testing or diagnosis, consulting a healthcare professional is essential to interpret results in the context of individual health and risk factors.